Hi, this is the beginning of my vlog, recovering from spinal surgery that resulted from osteomyelitis. On the 24th at about 2 a.m., 3 a.m., I got up in the morning. I got up to use the restroom and to get water. When I bent over to get a bottled water and I fell, my legs gave out and I could not get up. I just could not get up. I didn't have any strength in my legs. I called a family member to come and help me, and that's how I was able to get up and slowly make my way back to the bed. Um, that following morning, or in the morning of that, later on that morning, I called an ambulance to come and get me and take me to the emergency room at Jackson. I don't have insurance, so I had to depend completely on our community health system, which is called Jackson Health Systems. That's in Florida, South Florida, Miami, to be exact. Um, which has been okay. Um, and I'll get more into that in a second. So the ambulance came. They took me to emergency. This was in January the 24th. This is just before the coronavirus had been getting. We were still in the impeachment proceedings. So coronavirus had not gotten any exposure, media exposure yet. We were still focusing on the impeachment proceedings. Um, so I get to the hospital and I explained to the doctor when they come and see me that I fell, that I had been dealing with this pain since October, maybe since September of 2019. And that the pain wasn't getting any better, that I was dealing with it with just basically ibuprofen and Tylenol around the clock. Um, every 3 hours, I would take two Tylenols, followed by 3 hours later, four 200 milligram ibuprofen, and that's what I had been doing. Sometimes I would experience some relief, and sometimes it was just too much to bear, and I just couldn't make it to work. Um, I explained this to the doctor. The doctors right away, when they heard that that when I explained to them the type of pain that I was feeling, that I was radiating down to my legs, that I fell and I couldn't get up, they ordered an MRI. First, they did an X-ray, which revealed nothing, and then they ordered an MRI. It took a while before they finally came and got me to do the MRI. So much so that they had decided to admit me. Um, I don't really recall at what time they finally came and did the MRI, but they had ordered uh, a few MRIs with contrast, without, and one of my spinal cord and one of my my pelvis. I was only able to do the spinal cord with contrast because I couldn't deal with the pain of being having to lay down straight in the MRI machine. Um, a few hours later, the doctor comes in and sees me. The neurosurgeon comes in, um, and he tells me He has me explain to him again what I had been suffering, the history of the pain, and that coupled with the MRI, he goes, "We're gonna have surgery." And we had emergency surgery that very morning. Um, so I underwent surgery, and soon after the surgery, the pain, I experienced some relief. I wasn't completely relieved, and I experienced some new pain. My thighs were on fire. I was they explained to me that I had a mass in my spinal cord. Um, in my, I will have to get back to you on which one it was. Um, it was the vertebrae which affected my lower extremities, um, and the areas of my legs which were experiencing pain, which was my front thighs, the front of my thighs, um, eh, close to my groin area, and just above my buttocks, but inside, like it almost felt like it was in the joints. Um, so after the surgery, the intensity went down, um, but I experienced strength. I regained my strength in my legs to a certain degree. I was able to stand up, and what the MRI revealed, and a couple of other blood tests, is that I had osteomyelitis. And the neurosurgeon explained to me that what I was going to undergo was a laminectomy and a discectomy. A discectomy is when they remove all or part of your disc, the disc between the vertebrae, and a laminectomy, which is when they remove some of the bone in your vertebrae. And that was to relieve the pressure in my spinal cord that was affecting my nerves, which was then causing the pain to my legs. Um, I have to say that for the most part, the surgery was somewhat successful in the sense that I came out of it. I didn't die. I came out. I experienced some relief. I was able to lay down without being in excruciating pain. Um, of which I ended up staying in the hospital 28 days. Um, for 28 days, I was on pain meds. I was on half a milligram to a milligram of Dilaudid every 6 hours. They wouldn't give me any more than that. And 15 milligrams of oxycodone every 6 hours as well. They wouldn't give me any more than that. Gabapentin, every 6 hours, and pain patches every 8 to 12 hours. Well, rather 12 hours and then 8 hours off, and then another patch the following morning. Um, that was my routine for those 28 days. I explained the pain management, the amount of pain that I was suffering. Um, they were more concerned with me coming out of there, uh, being addicted to the pain meds, than they were in addressing the actual pain. When I was discharged from the hospital, I was not discharged with any narcotic pain medication. They just gave me gabapentin, 800 milligrams of ibuprofen, and the pain patches. It is April 20th, and I have been in pain since I got out, since I was discharged from the hospital. I have had 3 pain management appointments rescheduled as a result of the coronavirus pandemic, the CCP coronavirus pandemic, Communist China Party coronavirus. Um, and rescheduling, I hadn't been able to see primary care. I haven't been able to get any kind of care. I was able to finally get primary care one time so they could renew my pain patches and the ibuprofen, but she was adamant about not giving me any narcotic pain medications, that I had to see pain management. Um, I I left my primary care visit. I picked up the meds that were renewed, and I called pain management. And pain management scheduled me for a month away, or close to 2 months away, actually. I called back the hospital, the outpatient, and I explained to them the situation, that I had just had surgery, that I was in pain, that um, that I hadn't been able to see pain management, that because of the coronavirus, they had rescheduled me for a month away. Actually, I think it was 2 months away, and she scheduled me for the following Monday. Well, on that Monday, um, or on that Friday, I get a call that not to come in on Monday. Not to come in on Monday, that the appointments had been rescheduled. I should have come in because there were doctors there. Um, I made a mistake, and I couldn't take the pain, and I just did a walk-in, because I ended up going to emergency to explain to them what happened, and emergency again was adamant about not giving me any pain meds, any narcotic pain medication, that I had to go through pain management in order to get a prescription for narcotic pain medicine, which seemed to be the only way for me to deal with the pain. Um, so I went to the pain management clinic. Pain management didn't have any doctors. They made some phone calls, and they rescheduled me. Um, Needless to say, that when I neared the appointment time, they called me again and rescheduled me. I currently don't have an appointment with pain management until June. I have been dealing with the pain, which has gotten on and off worse since I got out of the hospital. Um, I went to go do an MRI. I did see the neurologist. I did go see the neurologist, um, they did an exam there, like to check my strength and to see if I was numb and to conduct an assessment based on what I reported. Um, so they said, you need to get an MRI. We're going to schedule you for an MRI and you're going to come back in. And I was supposed to be there April the 16th, um, with my MRI being scheduled for April the 13th. I went April the 13th. They tried to cancel that appointment, but I called the MRI department and they called back downstairs and said no, that I needed to get this MRI. And I went and I went to go do the MRI and I could not bear the pain of laying in that machine. I got up from there crying. Um, they proceeded to tell me there was nothing they can do to see if I can, try to go to emergency and explain to them what what I was going through. I told them that I had already been through there twice, and twice they refused to give me any narcotic pain medication. Um, I called the neurologist to explain to them that I wasn't able to do the MRI. So I am currently waiting for a response from neurology to see how to proceed with this. Um, Currently, I can't stand up for more than 4 minutes, 3 or 4 minutes before I have to sit back down due to the amount of pain that I feel in my front thigh, in the front of my thighs, especially the right one. Um, this has been the prevalent source of pain since I was discharged from the hospital after the surgery. The pain is like a burning cramp. And then there's another pain just a little bit above my thigh. It feels like it's in my pelvic area. But it feels like it's a tendon, but it's a nerve and it radiates straight down. And that is the pain that I was suffering from when I was inside the MRI machine. Once the pain comes in, I'm just frozen. I can't move forward. I can't move back. I can't move side to side. I just basically have to wait till the pain subsides a little bit to try to find a position that's comfortable enough for me to be able to try to sit back up and find relief from the pain. Um, yep, this is what I've been dealing with. Um, the source of the infection, the osteomyelitis, is unknown. Um, I haven't been able to get a follow up from the neurologist. I'm going to be calling them, following up. I called them on Friday. Um, I spoke to them on Thursday, actually, when they called to tell me that my appointment was canceled without them even knowing that I didn't do the MRI. Um, so I after that I received a phone call and it was left on my voicemail to contact them. I followed up and contacted them. They haven't contacted me back. Um, so I'm gonna call them. I gave them a couple days to call me. I'm gonna be calling them tomorrow. And in the meantime, I'm just left to deal with this pain, which keeps me basically bedridden. I can walk to the bathroom. When I get ready to take a shower, I have to get ready to jump in and jump right back out because I can't stand too long. I do get relief from the hot water, so I put the hot water towards my thigh and my pelvis, and that allows me to wash the rest of my body as the hot water is hitting me in that area. It allows me to bear with the pain. Um, so that's where I'm at right now. Um, I'm taking ibuprofen. I'm taking Tylenol. Um, and I'm not getting any help from the hospital, and that's what caused me to make this video blog. Um, I'm gonna publish this video, and if you have any questions, I'll try to answer them. I hope I didn't stumble too much over my words. Um, and based on your questions, I'll be able to post another video answering all the questions if I get any questions. Um, if you're going through any of this and you have a video log, please leave them in the leave a link to your video on the comment section, and I can check out your experience. Until the next video, thank you and stay safe. Bye.